This is NDTV. And you're watching NDTV 24/7.
Hello and welcome. COVID-19 positive cases in India have now crossed the 20,000 mark. There have been 1,486 cases reported in the last one day and 49 deaths. So that is just in the last 24 hours. So the total number of coronavirus cases in India right now today stands at 20,471. The total number of deaths have been 652. But on the positive side, there have been 3,960, almost 4,000 people who have recovered and they're fit and fine now after contracting the coronavirus. Yet, on the other hand, the coronavirus cases have been reported from 430 districts till Wednesday, up from 211 on the 2nd of April. That's what the government data is showing. And there are 6 major cities that have registered over 500 cases till now. They account for about 45% of the total cases across India. And while the total number of confirmed infections is rising, government health officials say the speed of transmission is slowing thanks to the nationwide lockdown that began on the 25th of March, and that's going to be in place at least till the 3rd of May. So what should we make of all of these numbers, these facts, these figures, and how do we need to protect ourselves and our loved ones going forward? I'm sure you have a lot of questions. So this is the show where we bring you the best in the business, the best doctors. We bring them to you so that you can ask them all your queries, all your fears, all your anxieties around coronavirus. And today on the show, it means we have Dr. Richa Chaturvedi. She's a diabetologist and endocrinologist at the Indraprastha Apollo Hospital in Delhi. And we have Dr. Professor Hemraj Chandalia. He's the Director of Endocrinology and Diabetes at the Jaslok Hospital in Mumbai. Thank you so much, doctors, both of you joining us on a day when the government has pushed an ordinance to say that there's going to be absolutely no tolerance for those who work on the front line in this fight against the spread of the coronavirus. We're talking about people like you, doctors and nurses and everybody in the healthcare industry who've been working so hard. So thank you for taking time out to talk to us today and to take the calls of our viewers. Before I go across to our viewers, I just want to quickly ask you, one of the big trending topics today has been those human trials that are supposedly going to begin. That's what we've been reading about in the news. So there's a lot of curiosity and interest in this. A potential vaccine, we're being told, against the coronavirus being developed at the University of Oxford that's going to be tested on people from Thursday. That's what the Health Secretary Matt Hancock has said, and that the UK government has invested some £20 million or making that available for this team at Oxford to develop this vaccine further. So, Doctor, to you, Dr. Professor Hemraj Chandalia, what could this mean for all of us who are in this fight against the spread of the coronavirus?
I think vaccine will be the most important tool to ultimately control this disease. And that is the aim. And in fact, what we are doing is really buying time until we can have the sure remedy at hand. However, although the trials will begin, but really to get results of trial, and more than that, scaling it up where you have millions of doses available is time. Now the time lag that you're going to have, for example, the results of trial also will be very rapid. I think it will be permitted to go in a very fast speed because it is required. But scaling it up will take time. But I think, the whole world, you see, is now busy doing how we can do it fast and do it well. So I have a hope that it will change completely the paradigm. The speed with which these things are done might change completely.
All right, so that means it is a long road ahead. First, will this vaccine work? Then can those doses be made in such large numbers that everybody, because all countries, really very few countries that are still unaffected. So Dr. Chaturvedi, Dr. Richa Chaturvedi, this means that until then, we just got to make sure that we are we have a high immunity, we are keeping ourselves safe, and we're staying healthy.
Yeah, that is true. See, vaccine is going to be the ultimate game changer, but vaccine has to be given in the people who have not contracted the disease. So the safety profile has to be extraordinary. So that will take time to develop. As the experts are saying, it will take around 1 to 2 years. So that's a long time, long road ahead. So in the meantime, we will have to keep following the same, same methods to protect ourselves, like hand hygiene, respiratory hygiene, social distancing, not to make unnecessary travels, not to make unnecessary visits to the hospital. So, those kind of measures will continue. And, the social distancing thing is not going to go away. We will have to keep following it for probably at least next 1 to 2 years.
All right, so this clearly this is the new normal perhaps, and this is what we're going to have to live like for the next year or so, if not. All right, let me quickly go across to Ravi, who's calling from Mumbai. Ravi, what's your question?
Yeah, hi. I had a question. I use a soap cake, not liquid soap, okay? A soap cake always to wash up whenever I go out and come for purchases. Does corona stick onto a soap cake also, like they say it stays for 3 days on plastic, 1 day on paper, and 3 days on steel, etc.?
That's
an interesting question.
Yeah.
Soap is a disinfectant, so it's not going to stick to the soap. Any soap with water will work as a disinfectant, or if that is not available, any alcohol-based sanitizer which has 60 to 70% of alcohol, that will work. So don't worry. Soap, I don't think, doesn't need to be one of our already many worries. It's not going to stick to soap and cause further problems.
So you can go ahead and use a cake of soap. It doesn't have to be one of those fancy liquid soaps in those big plastic bottles and just add to, the plastic landfills all over the country. All right.
No, any soap would work.
And Dr. Chandalia, let me just reiterate again something that we've been saying, but it's been over a month now, so people may forget. Is it, is it important not just that you wash your hands, but you need to build up a lather, and you need to keep washing for at least 20 seconds, hopefully with keep the taps off while you do that, everybody. Dr. Chandalia?
I think the 20 seconds is very important. Extremely important. Some of the soaps or soap lotions will lather very well, some of may not. But it really is the 20 seconds which is the key. And of course, how to do it has been shown in the media. So it is really the palms, the other end of the arm, and then the thumb separately. 20 seconds is important. So either one counts for each of these areas for 5 seconds. 1, 2, 3, 4, 5. Then go to the next one. 1, 2, 3. I think, but it has to be done meticulously. And children have been taught to sing the whole happy birthday and complete, 2 times, and then only the washing is complete.
All right, so it's important to stick to the 20-second rule. However, you teach youngsters about it, but that's really important for everybody. Captain Kamal Singh is calling from Jammu. Go ahead, Captain.
Good evening, everybody on the panel. We have been hearing the disturbing news about the kind of attacks which the medical fraternity has been facing. And I do not know how far the inputs on the social media are correct, that more so they are very prevalent in India. And I, as an individual, feel that what is the medical fraternity doing in order to, check this thing? But let's not think just about corona. It's about, the safety and security of this team. And not only for this particular thing, but we say it's so rampant. But whenever such things happen, only then, these things come to light. So could you kindly tell me what are we actually going to be doing about this very seriously, so that the people dare not do such thing in future? It's really very disturbing.
Captain, thank you for asking this question. I think that's been on the top of minds of many of us. Certainly here at NDTV, we constantly have been trying to push for this, to more security, more respect to everybody who's on the front lines, putting their own lives in danger, the lives of their families and their loved ones in danger, to go out there and do their jobs. Dr. Chaturvedi, your response to Captain Kamal Singh.
Thank you for your empathy. The step which has come today by the government is a welcome and much needed step, and I hope it will definitely help in protecting the fraternity, and I hope the measures taken will not go away after the pandemic is over, and they don't apply only to the people who have suffered violence dealing with corona cases. It should be for any kind of violence, even dealing with non-corona cases. So people he asked me what he can do. I would say people should not have undue expectations from the doctor. Don't put us on a pedestal. We are doing our job. Give us the environment, give us the right environment to do that. Do not have extraordinarily high expectations. Do not treat us like normal human beings. We are trying to do a good job.
That's very humbling of you to say so, Doctor. Don't put us on a pedestal. We're just trying to do our jobs. We have Mr. Raman Rao calling from Hyderabad. Go ahead, sir.
Good evening, madam.
Good evening.
Just now I saw from the ICMR report, RT-PCR is the only test to confirm COVID negative. A country like India, is it possible for us to go for RT-PCR to confirm COVID cases?
Dr. Chandalia?
Yes, I think we have to mobilize. There are a lot of laboratories who are doing the PCR now, and I think we have to go more and more for this, because this is the test with maximum sensitivity. See, the antibody test has serious limitations, as we saw a couple of days ago. The kits really detecting antibodies. Either the kit may be defective, or anyway the antibody body response has certain time lag, and that time lag is not taken into account, so the results can be very bizarre. So I think we have to exploit the full capacity, the laboratories which have facility of PCR, and really push this test very, very fast, because testing and tracing the contact is the key now to our success eventually.
So testing is key, test, especially as these numbers continue to rise, even though the government says the doubling rate is slowing down. Annie joins us. We have a caller, Annie from Ahmedabad. Go ahead, ma'am.
Yes, I am a diabetic patient as well as, and I have an autoimmune disorder, Sjogren's. So according to my diabetologist, I should not be taking HCQS because it creates low sugar level. I've been prescribed HCQS since 4 years due to my autoimmune disorder, that is Sjogren's. Now the confusion is, should I take HCQS or should I not take HCQS?
Well, you picked the right day to call, Annie, because both of our experts today are diabetologists and endocrinologists. So go ahead first, Dr. Chaturvedi, and then perhaps Dr. Chandalia can answer her question.
So about the fact that HCQ causes low blood sugar level, I would say no, not just like that. HCQ has also been tried in our country as an anti-diabetic medication. So your diabetic medications are to be adjusted by your diabetologist or endocrinologist. But if your rheumatologist who's treating your Sjogren's syndrome, if he thinks you should be on HCQS, then you should be on HCQS. Do not discontinue that. That's not going to harm your diabetic condition, not at all. Just don't worry.
Dr. Chandalia, would you like to add to that?
Yes, I think it's a very important piece of information regarding HCQS, which was not, the media does such a great job. This has not been done very well. It has been recognized as an approved anti-diabetic drug in our country, by the way. This is almost for the last 2 years. Hundreds of people have this drug. It lowers the sugar, but does not cause much excessive lowering, or not much of hypoglycemia. And if you are already beautifully adjusted with this, there is no reason for you to discontinue this. We hope that it offers you remotely some protection against COVID-19, but I would not trust that, because the evidence for that is still to emerge.
Of course, I'm glad you touched on that, Dr. Chandalia, because if both of you can just address the larger controversy, you know, after all that Donald Trump's faux pas where he threatened India, the plan to actually use HCQ for treating COVID-19 patients in the US has received a setback, because now there are more deaths being reported among those who have been given this much touted anti-malarial drug, and that's according to some reports, US reports, and other studies have said that it doesn't work.
So there is a small study which has come and which is saying that HCQS does not work. See, it's a small study, first of all, to begin with, and it will depend in which stage of the COVID disease the HCQS is being used. If you give it in early stage, especially as a prophylaxis, that is more likely to work in high-risk population. But if it is being given when the disease is already advanced, it has already produced exaggerated immune response, then that is the time HCQ is not likely to work so well. There are other agents like remdesivir and other plasma things, they are more likely to work at that stage. So at what stage you are using HCQS, that is important. At the small study which has shown that HCQS is not effective, it's a small study, we can't really, more research is required to comment on that.
Okay. Thanks so much. Let me quickly go in for a short break. I know I have callers who are just, piling up. We have a long list of them. Let's quickly take a break so we can come back to more callers.
Knowledge Partner, USP, your reliable healthcare partner.
Pharmacy at home.
Empty.
Download the Polo 24/7 app now.
जिनका हो एग्जाम क्रैक करने का ऐसा जुनून, उनका तो हक बनता है कहीं से भी पढ़ने का। अनअकैडमी, लेट्स क्रैक इट।
कोरोना आज विश्व के लगभग सभी देशों में फैल चुका है। डाबर च्यवनप्राश, जिसकी 40 से अधिक आयुर्वेदिक जड़ी बूटियां करें इम्यूनिटी को स्ट्रॉन्ग। इम्यूनिटी स्ट्रॉन्ग करने के लिए मिनिस्ट्री ऑफ आयुष, भारत सरकार ने भी च्यवनप्राश जैसे आयुर्वेदिक उपायों को एडवाइस किया है।
कुका कॉफ सिरप की तरफ से आप सबसे रिक्वेस्ट है कि प्लीज घर पे रहिए, लॉकडाउन का पालन कीजिए और कोरोना को हराने में सरकार का सहयोग कीजिए।
It all boils down to your safety. And today, keeping yourself safe means keeping your dear ones safe, your city safe, your country safe, and in turn, the whole world safe. How can you do that? It's simple. Stay calm, stay positive, follow best hygiene practices, and most importantly, stay home. When you stay home and practice social distancing, you help in flattening the curve and stop the spread of this virus. And as you do your bit, here's what we are doing to help you. We are prioritizing your orders of household staples and essentials, packaged food, healthcare, hygiene and personal safety products, and delivering them to you so you can stay home. Stay home, stay safe. We are in it together.
First, be aware. Try to immediately close with your hand. If you have a kerchief, use that kerchief. Ideally, if you have a mask, use the mask. Step back, because there is a distance to which it can travel. Step back and don't touch anything that has fallen there. If you have touched, you must wash your hands very, very clean. That is very, very important.
ऐसे फैमिलीज को खाना बांटा है जिनके पास पिछले 2 हफ्ते से कोई काम नहीं है।
इससे सारा परिवार खाएगा, खुशी से रहेगा। बहुत खुशी है।
The food prepared by Oxfam, soon this will be shifted to where migrant laborers live. The challenge is quite huge.
We our side supply the food. They need money, they need medicines. For children, they need milks, snacks, anything, sir.
कम से कम 250-300 लोगों को तो खाना गया ही गया।
When I wanted to take a life insurance policy, I visited the LIC website. It's so user-friendly. You can choose a policy, make a premium payment, and do a lot more. Why go anywhere else?
I like it.
इतना slow, match तो गया.
Dad,
आपने ये वाला सुना है?
Like it.
Watch this. And this one?
I love it. I got this.
Spotify के 50 मिलियन सॉन्ग्स के साथ डैड को रोज नया म्यूजिक सुना? Spotify सुनते जा। डाउनलोड द म्यूजिक ऐप फॉर फ्री।
All right, this is our Doctors on Call show. We have the best in the business to answer all of your questions. So, Anuradha from Bangalore, thank you. We appreciate your patiently waiting during that ad break. Go ahead. What's your question, Anuradha?
Yeah, hi. So, my question is regarding sanitizing vegetables. So, the WHO site says that just washing it in plain water will be sufficient, but soap is required to break the virus. So, should the vegetables be washed in soap water? Because it could get transmitted from person to person, and it could have been in contact with somebody who could be COVID-19 positive.
Dr. Chaturvedi?
Vegetables?
Do not use soap for washing your vegetables and fruit, because fruits and vegetables are porous and soap will go inside, which is harmful. So if you wash your vegetables and fruit with lukewarm water, as it is 90 to 95% infection will go away. But these days, I would suggest baking soda is a good option. You put some baking soda in a lot of water in a container and put your vegetables in that for a few minutes and then take it out. And those can be consumed easily, harmlessly.
We're all going back to the good old days. Pankaj from Mumbai, go ahead. What's your question?
As you all know, hello, can you hear?
Yeah, Pankaj, go ahead.
Yeah, as you all know, Mumbai is a hotspot. How concerned should we be on the scale of 1 to 10 to be infected? And the impending monsoon, which is just 50 days away, can there be a worse outbreak as the one soon? And why do we often use the word social distancing and not physical distancing?
Yeah. Well, Dr. Chandalia, you obviously should take this question. You're at the Jaslok Hospital in Mumbai. It's a hotspot, the state with the highest cases. Go ahead, please respond.
Yeah, I think this infection is a very peculiar one, where the infectivity is extremely high. And although some of the hospitals who venture to continue working, you see, not infected with all the precautions that were taken. The reason is that there are asymptomatic carriers, which we have been discussing last week or 2 weeks in detail in the media, and that asymptomatic carriers, unless we start detecting those, the spread cannot be, checked very easily. Now, what is going to be the outcome after the lockdown is lifted? It's very difficult to say. I still feel that another 9 to 10 days of lockdown will cool some of the hotspots. They will cool. If we go very vigorously in checking large number of people and checking the content and going after the contacts, and checking them out, isolating them, then we will succeed. But unfortunately, the number of kits required to really do the tests are not easy to come by anywhere. In the global scale, there is scarcity of these kits, and therefore you cannot really start a very extensive checking. So with these limitations, under which each country is laboring under such limitations, I have a optimistic feeling. I feel the problem will be there, but the curve will be flattened, and with the usual precautions of physical distancing and hand washing precautions, I think we will slowly come out of it. We will not be totally out of it, but we will come out of it in the next few months. And the whole world probably will go through this experience.
Oof. All right, let's go across to Jobin from my home state, Kerala. Jobin from Ernakulam, go ahead. What's your question?
Good morning. Thank you for giving me to ask this question. It is heard that India's testing rate is very low compared to the population size of India, but it is not practical to test everyone randomly, which we are having a population of 130 crore. My question is, why can't we mix 5 or 6 samples together and test for the result? After getting the result, if we found positive, we can do separate testing, which will avoid misuse, which will make adequate usage of testing kits.
Okay. Dr. Chaturvedi, where do you stand on the testing debate? You have the WHO and some countries which have shown that they've managed to flatten the curve. What they've been doing is test, and more testing. Where do you stand on this debate?
See, we know kits are limited, so we have to, as of now, we have to use that judiciously. India is likely to produce many more kits in lakhs by May, but right now we don't have so much stock, and the kits which have come from outside are faulty. And then we have to be clear what we want to achieve by testing. Testing in high risk people, healthcare workers, or people who have come in contact with a positive case, it makes sense to detect. And which test are we going to do? That also we have to decide. Like the test we use, RT-PCR for molecular testing, that is going to be useful in first 7 days.
Yes.
And for doing RT-PCR, you need a nasopharyngeal swab, you need a throat swab. So and it's a difficult procedure. You have to, somebody who's doing it has to be in proper personal protective equipment, has to take it properly, so as not to contaminate himself or herself or anybody else. So, and after the sensitivity of this test is 70% in first 7 days, and later on it goes away. And that is the time when immunoassays, IgM and IgG, they become more useful, which are blood-based and more easy to do. So in what stage we want to do the testing, what we want to pick up, we have to be clear about our objectives, and then only we should be testing. As of now, we shouldn't be really unjudiciously using up the kits.
Dr. Chandalia, you were nodding when you heard Job's question. Where do you stand on this whole testing debate?
I think like Korea and some countries who really have advanced technology and could produce a lot of kits, tested extensively, and it really helped them in getting a control of the situation very fast. However, when the resources are limited, and this is true of many countries, many rest of the countries, we have to really allocate all these resources to the real requirement. As Dr. Richa said, where the yield is going to be high. So naturally, contacts of people who have the COVID-19 infection, or of course the medical personnel, and those susceptible ones you are likely to do, you get a higher yield and you get a better utilization of the kits that you have available. At the moment, we are in that phase. But India will change things very fast because we do have the background and we really have the capability of going fast into some of these productions. And I hope we will have more kits available very soon, maybe in the next couple of weeks. And then you see later on, after the lockdown is lifted, I think again the testing and following the contacts will continue. And then also you get control over this situation.
Thank you, doctors, Dr. Chandalia, Dr. Chaturvedi. Thank you from all our viewers, all our callers who called in today, got a chance to speak with you, and from all of us here at NDTV, thank you so much for your time.